Thank you.
We're talking now, I guess.
All right, good afternoon, everyone. Thanks for joining us for today's webinar on community-based water safety efforts. We are extremely grateful to be joined by 4 leading experts on this topic for today's panel. I'd like to give a special welcome to Alyssa Magrum, Executive Director at Collins Hope, Blake Collingsworth, founder of Joshua Collingsworth Memorial Foundation, Pam Canal, the Executive Director of the Fort Worth Drowning Prevention Coalition, and Paula Degregory, Executive Director at NCH Safe and Healthy Children's Coalition. I'd also like to thank D&D Technologies for sponsoring today's webinar. Today's webinar will be a full discussion on grassroots water safety efforts. While the NDPA is a national organization, we do firmly believe that drownings are prevented locally. The NDPA will be expanding its efforts over the next year to focus efforts on grassroots initiatives, so this is a really good start to that initiative. Attendees can participate in today's webinar by using the chat function or the question and answer function located on your screen. I'll be monitoring that through today's webinar discussion, and we'll try to get to as many attendee questions as possible. So with that, let's go ahead and dive right in. I'm going to allow each of our panelists to do a short introduction for themselves. So we'll kind of a toss-up. So I'm going to let Alyssa go first because it's her birthday and she's taking time out of not only her birthday but also her vacation to join us. So Alyssa, do you want to give a quick introduction to yourself?
Oh, thank you. Sure. So my name is Alyssa Magrum. I'm the Executive Director of Collins Hope. We're an Austin, Texas-based drowning prevention organization. I'm also on the board for Safe Kids Austin, the board for Texas Drowning Prevention Alliance, and on the advisory council for the National Drowning Prevention Alliance. So I'm happy to do this work. I've been doing this work in drowning prevention for the last decade. I'll talk a little bit more about Collins Hope later, but I came into this because my daughter's preschool classmate, Colin Holst, drowned. And as a
Oh, did we lose Alyssa? I think we lost Alyssa. So we'll hopefully get her back in touch. Let's go to Pam Canal for her introduction. And I have to say, I think Pam has probably the most interesting story of how she started her grassroots efforts.
Thanks, Adam. I'm Pam Canal. I'm the founding director of the Fort Worth Drowning Prevention Coalition. I also sit on the board of the National Drowning Prevention Alliance and sit on the Child Fatality Review Team for our local Tarrant County. Do you want me to go into the story of how we started, Adam?
I think you need to.
All right, all right. Well, I'm all about networking. And so whenever I have an opportunity, I do get out and about and network in any way possible. And one of the things that I like to do is bike ride. And we have a mayor in town that is just very approachable in any format. And so I went on a bike ride with the mayor and I said, I think we have a problem in Fort Worth with drowning. And I'd like to talk about a potential way to affect the numbers in our area. And she said, well, let's do it. And she had the chief of staff, of course, was on one side of her and the assistant chief of staff on the other side. And she looked at them and said, start opening doors. So that's how we got started.
Oh, that's awesome. Takes that great initiative to get things underway in a local community. Blake, welcome.
Thank you.
Do you want to give us a little bit of background on yourself and Joshua Collingsworth Memorial Foundation?
Yeah, I never in my wildest dreams thought I would be in the position where I'd be talking about water safety and drowning prevention. my wife Kathy and I were kind of thrust into the conversation in June of 2008. We lost our son to a backyard pool drowning at a large family gathering in our backyard. And we live in Lincoln, Nebraska. So it's not as prevalent, not on the front page, especially back then, 11 years ago, the social media and computers were just kicking in. But when I did get online and started seeing the statistics, and sadly, I was one of those people that didn't know that drowning was the #1 cause of unintentional death to children 1 to 4. I knew that obviously children shouldn't be around water by themselves, but I just could not believe the prevalence of it. And we thought we have a pool cover on our pool, we have fencing, we have most of the things that people think is going to keep their kids safe, but they're really fast and they get into circumstances so quickly that we have to be very, very diligent. And our goal then became, how do we educate kids? Because Joshua was 2.5 and very willing to please and wanted to please mom and dad. So we started an organization in his honor and wrote a book, Josh the Baby Otter. And we worked to go out and educate children that they'll be self-reliant and learn the importance like they do in seatbelt safety. They've been in seatbelts all their lives, and so they're used to it. We think we should be talking to children about water safety from day one, so they're used to it.
Excellent. Thanks for joining us, Blake. And last but not least, Paula Degregory. Hi, Paula.
Hi, Adam. Hi, everyone. Thank you for having me. And I'm original from Bogota, Colombia, as you can tell from my accent, but I live here in Naples, Florida, since 1996. I serve on the board of the National Drowning Prevention Alliance, and also I serve in the Water Smart Florida, which is the Florida Task Force here in Florida, and I also serve in the child review team here in the local district. But the way that we started the coalition was back in 2010. It's going to be 10 years next year. I was working for the Florida Department of Health, and after H1N1, we created a task force because we had an increase of number of drownings happening, pediatric drownings. And after we created the task force and looked at data, I realized that we needed to create a coalition. And from the beginning, it was a team effort with so many agencies working together, which I will be more than happy to explain how we did it. And we have been very successful because of the collaboration of everybody, and also not to reinvent the wheel. And that is, we have become very good to steal ideas and replicate them here.
Excellent. Thanks, Paula. As you can see, we have just such a variety of expertise on our panel today. I want to start off the discussion. I think some of you have already briefly talked about this on how your group started or how you got involved in this work. But I feel this is such an important area that we should discuss because, you know, sitting at NDPA headquarters, I do get a number of inquiries throughout the year on how do I start a local initiative or what challenges am I going to face. So I think I'd like to start off our discussion by each of you just kind of briefly describing how you and your group got started, and more importantly, what was that experience like? You know, I know today we're going to talk about successes you had and challenges, but whether that was a challenging experience or an easy experience, what was it like to get your group and your grassroots initiatives off the ground? Pam, would you like to start us off?
I'd be happy to. Thanks, Adam. You know, as I mentioned previously, you just have to use your network, your resources to reach out to anybody that might be able to help you in bringing a team together. I always personally try to start as high up on that decision-making chain as I can. I thought the mayor was a pretty good place to start, and it worked well for us. And then, as Paula just said, know your data. You have got to drive down into the data of your local area. The poignant stories and testimonies are absolutely necessary. They'll open the doors for you, but you need to back that up with good data in your area. And then the next step for us was to, you know, get that foundation shored up. What is our mission statement? What is our vision? And then finally, after And all those, the mission statement, the vision, they'll inform every decision when you start moving forward. And then finally for us, it was important to create a strategic plan so that we had some direction. We had a team. We didn't want everybody going in different directions. What is our plan and our strategic way of approaching the mission statement?
Awesome. Thanks, Pam. Alyssa, do you want to, I think you're back and
I'm back
with us now. Do you want to talk a little bit about how you got started in this and what maybe successes or challenges, what it was like to get your local efforts in Austin started?
Sure. So I don't know where I froze up before, but Colin's Hope really started similarly to how Blake was talking about, but Colin's parents lost him to a drowning in a lifeguarded pool in 2008, and they started in a similar way after seeing the statistics. And Colin's Hope began 3 months after Colin drowned with really not a formal plan, no strategic plan, no real mission or vision, except they wanted to do something to save other families from going through what they did. So we started out very much responding to anyone asking us to be somewhere to do something that could educate parents and families around water safety. And as we moved through starting an organization, and I was the first executive director after being a volunteer, we got a strategic plan. We got really clear on what we were good at, which is, this is a very quick version of the story, but we found out we're really good at doing parent and caregiver education and really good at educating children. And we feel like we have to do both. So over the last decade, we have started taking what's our hedgehog, what we do well, what we have resources and passion around, and trying to do that locally. And then consequentially also through partnerships, whether they're regionally, locally, statewide, or even nationally, we try to expand on what we do well and then work with other people who do things really well. So for example, we don't teach swimming lessons, but we know that that's a layer of protection. So locally in Central Texas, we partner with the YMCA or with any swim lesson provider that we can to work on that side of things, where we work on the parent and caregiver education. And I can't echo what Pam said more loudly, but the data, the local data for us, we track the state fatal drowning data with the Department of Family and Protective Services, and try to look at the non-fatal drowning data and really develop our prevention messages, develop our programs based on what's actually happening. So for example, if we are seeing bathtub drownings, or have backyard pool drownings, or we try to build our messages and our strategies around what's actually happening. And again, to go with what Blake was going into, is this whole culture of water safety. And we're trying to be really strategic about how we are teaching kids and educating kids and parents and caregivers from the earliest of age to think about water safety and to develop those behaviors to be safer around water from the earliest time. And it's partnerships. I mean, really, everything that we do is partnerships. We cannot be exclusive with even swim schools or corporate pool service companies. Anyone we work with has to agree to get in the pool together with us, because it's going to take all of us working together. And I think that's a huge lesson that in drowning prevention, if we don't work with one partner because we work with their competitor, we're missing people that we can reach with this message. And I think that's so important in doing this work. So again, finding our place, finding our niche, finding what we're good at and doing that really well, and not trying to do everything. And then focusing on the strategic plan, the strategic goals, and working those goals and using those as a blueprint. Because if you go off the plan too much, you're not going to achieve your goals. And so those are our basics. I could go on forever, but I know that's probably my time is up. So.
This isn't a debate, so I'm not the end.
I know, but I feel it.
So thanks, Alyssa. I'm going to turn to Paula next. And, what I think is so unique about our panel today is they each come at this from a local perspective, from a little bit of a different angle. And Paula, I know your coalition is actually part of your hospital system, correct? So would you explain a little bit how you got started and how you and kind of how the hospital has helped and get you to where you're at today?
Yes, like I said before, in the spring of 2010, that is when I was working in the Department of Health, and the department director asked me to create a task force to see what was happening with increased number of pediatric in drowning deaths. And after meeting with EMS, with the other hospital, with the YMCA, Parks and Recreation, we decided that we needed to create a countywide initiative and create a coalition. And after many meetings, we decided that we wanted to create one initially injury-related coalition led by hospitals. And that is when the NCH healthcare system said that they will take the lead. That is the only pediatric ER and also birthplace that we have in Collier County. However, from the beginning, that is something that I will repeat myself, is that you have to have everybody, like Alisa and Pam said, meaning we were under one hospital, but we have two hospitals in Collier County. We said we need to have a board member from the other hospital. After we created the mission and the vision, and everything that we do is data-driven, we develop a relationship with the local medical examiner. And also because I was working for the Florida Department of Health, I was able to get some of the data from the vital statistics, and then trying to get the non-fatal data from the hospital, from NCH. But one of the things that we said was, yeah, let's understand the trends in Collier County, and also let's see what other people around the state, because unfortunately Florida leads the nation for drowning deaths. And we were very lucky that we were very close to Broward County, and they have a very strong drowning prevention task force. And we actually drove many times to Broward, and they drove to Naples in the fall of 2010. What we did, we were ready, we formed the coalition, we had a board, we created the call to action meeting where we invited county commissioners, city council, and then 10 people from Broward came. And then we said, okay, if Broward is able to do it, we can do it. We used in the beginning the strategic plan from them, and they start looking at the things that was going to fit in Collier County. One of the things that I will say to everybody is like, start small. From the beginning, we wanted to start big, like Swim Central was originated in Broward, which is a 10-day water safety program. We wanted to do the numbers that Broward wanted to do, but we weren't able to do that, which was a blessing. But one of the other things that we did was we wanted to hire a full-time person. The first year, the board concentrated to look funding for that. And then we were able to do that. And then I became the executive director, and I moved from the Department of Health to the hospital. And one of the things that I will say to you that it has very wonderful beneficial to us is that attend the National Drowning Prevention Conference. You know, I've been attending it maybe since 2012, and I will say that I always connect with people. I always get ideas. You know, like we have Stewie the Duck. I met Doreen, and it just is so many. I will say none of our programs have been new to us. We have stole all the ideas, and it's because of attending those conferences. And it just is no need to replicate, you know, in working all together, and also having a strategic plan and continue looking the data. Is going to definitely get you where you wanna be, and also be sustainable. The finances is also important to be looking on that.
Excellent, thanks, Paula. Blake, last but not least, could you give us a little insight into how Jay Cmf got started, and especially some of the efforts? I know coming out to Lincoln and seeing all your efforts firsthand, you guys are doing great work locally. How did you get started on that?
Well, it was actually pretty frustrating in the very beginning. I reached out to different people that I knew, and I was kind of surprised we weren't getting the immediate support because of the need, obviously, what my wife and I were going through emotionally, and we thought anybody we would talk to would jump on board and help us. It doesn't seem to always work that way. Sadly, everybody has things that they're concentrating and they're working on. So to get them engaged in the very beginning was frustrating. What I would recommend to people is reach out to your connections, and that's connections. Like Pam's great that she was able to go bike riding with the mayor. Maybe if you can't go bike riding with the mayor, do you have a neighbor that will go bike riding with the mayor? That's the point of finding connections. For our example, we went right away. We went to the YMCA in Lincoln, and at that time there was 3 of them. There's now 5, and we talked to them about working together on more swim programs. And the Y does great work, but they're also concentrating on soccer and Little League basketball and all those other things. And I was getting some pushback because they were very busy. Well, I went and I got online and I started looking into the board of the YMCA and found out that I had connections with 3 of them. So I reached out to all 3 of those connections, and they circled back around and told the people that had been dragging their feet with me that they had to start doing something. So my recommendation is that you dig deep into the organizations and the people that you would like to align yourself with and get help with, collaborate with. Once they really understand that you are there to help them and work together in a collaborative effort, they'll open up to you. At first, they think you're asking for many different things, but use those connections that you have, whether it be relatives or friends, to find out, do your research on who you're reaching out to. We were able to, the Children's Hospital in Omaha is a very good partner of ours, and that's where Joshua was life flighted to and passed away a few days later. It just so happened that the chairman of the board of Omaha Children's Hospital owned a lumber yard that I do business with. And so just even a simple phone call to him to say, who can I talk to? And he directed me to the right people. And then when you're able to drop his name, that helps you get in the door. So it's the same thing with Parks and Recs, with your local swim schools, your local swim classes, your politicians, anybody that you're thinking about working with. Do your homework with them. Let them know you want to collaborate. Just like Alyssa said, we're all in this together, and there is no way that we're going to have the impact on the problem unless we team up and come at this full force. Every person that's engaged needs to work together to make a difference.
Thanks, Blake. So what I had planned next was to start talking about some of what you found to be your biggest successes with your local efforts. But there was an audience question submitted that I think is going to resound in both the biggest successes and maybe some of the biggest challenges that we face from a local effort. The question received from the audience was, what is everyone doing to get better reported data on fatal and non-fatal drownings? So as we talk about our kind of largest successes and maybe our biggest challenges and hurdles to overcome, I think some areas have had great success with local data. Some areas probably still have challenges. So I know Texas is doing really well tracking their local data. So Alyssa, I'll start with you. If you want to talk about some of the biggest successes you've had and maybe how data has tied into that either as a success or challenge.
Sure. Well, data is a challenge no matter what. In Texas, we do really, really well with our fatal drowning data of children. We know to date, I know right now, as far as best that we can, that we've lost 45 children to fatal drownings in Texas this year already. We lost 91 last year. And while those numbers, I hate seeing every single one of them, we are able to see them and dig into them and figure out where kids are drowning, what is happening, and help develop our messages around that. So statewide, and we can see that by county, we can see it by age, gender, location, type of water. Our non-fatal drowning data is really difficult. It's hospital to hospital, as Paula was mentioning. It's EMS logs, hospital reports, submersion logs, any bit of information that we can. And that's been very challenging. I know in Central Texas, we have a data workforce group with Department of Health and variety of Safe Kids and other groups that we're really trying to get a better handle on that data, because we know that, it's an estimated 5 times as many non-fatal drownings occur. And if you don't know where they're happening or don't understand them, those prevention messages are really, really different. So data for us is a constant struggle, sadly, but you have to do it. I read drowning reports all day long to see and understand, and they're not just local ones. I mean, I'm in Florida on vacation right now, Paula, but I read everybody's reports daily, because that helps us understand the bigger picture and how in Texas we fit in. Actually, this kind of ties into one of our greatest successes. I feel like Collins Hope has become a trusted resource in the state of Texas, certainly in Central Texas where we are, but across the state as a water safety resource. And that is probably I feel like one of our biggest successes. One of those partnerships is with Department of Family and Protective Services. And through that partnership, we impact home visitors that go into homes and do parent education. We impact child care licensing that the Department of Family and Protective Services works with. So families across the state, that's probably one of my biggest successes, and the other one that I would probably mention is around our Water Safety with Colin and Friends curriculum, and our parent water safety educational cards. And I have props. I brought props, right? So little resources that we have developed over the last decade, that we've evaluated, and we know that they work to raise, to increase kids' water safety knowledge and educate parents. Pushing those things out and focusing our efforts on getting those resources out, and then working as a resource in our state and beyond are really our biggest successes, and we will focus on those, because being a trusted resource means media attention, means getting a chance to sit at the table for important conversations and press conferences and things like that. In Central Texas, we lost 6 children in a period of 3 weeks in the last month to fatal drownings. And I did so many media interviews and press conferences, and they're hard to do, but when they're calling Colin's Hope, I know that means that they trust us. And that to me is a huge success for us.
Alyssa. Pam, I know you're not too far away from Alyssa in Texas. Do you want to share how, maybe you access some data in Fort Worth, how you're able to track things, and how that has affected your coalition's work?
Right. The same as Alyssa, we do depend a lot on the Texas Department of Family and Protective Services data for children, and the Health Department for the child fatality data. However, we also at Fort Worth Drowning Prevention Coalition are concerned about our adult drowning data as well, and we turn to the USA Swimming data that they send out on a monthly basis to massage that and to follow trends within the North Texas area. We find that data very useful for following trends and looking particularly in our area at the present time on open water drownings, which are a concern. So I also echo Alyssa's concerns about the non-fatal drowning data. That is an issue. To drive down a little bit more locally and within our own coalition, we find it extremely important to look at our program data. So whether we can determine that our curriculum is effective. And so we collect students' self-reported skills assessments upon coming into our program. We collect the data on their successes and assess how far they've come within the program. We send out volunteer program evaluations. We send out student program evaluations at the end of each of our sessions. We evaluate our board on an annual basis. So that type of workflow that we set up, the database we use is Salesforce, that there's a number of ways that you can set that up. But I think it's important to have those internal measurements as well to make sure that you are aligning with your mission again, and that what you're doing is effective.
Paula, do you want to tie into what Florida is doing for data collection, and maybe what some of the biggest successes with your coalition has been?
Yeah, I mean, at the Florida level, we have the vital statistics, which is called the charts, where we can get this data, and then the Department of Children and Families. The Department of Children and Families, they have a website, and every day, unfortunately, I go and look the data, and they don't investigate every single drowning related. They should, but they don't. That mean, and they have some information, the specifics of what the tragedy happened. The vital statistics with the Department of Health, that is always a little bit behind, and it still is the way that it's coded is usually so different. And the reason why we know that is because we know here in Collier County, the children, the fatal drownings, because unfortunately, every time that a situation happens, EMS, fire, or the hospital, they are calling me and they are texting me. We know right away when a fatal happened. And then also the non-fatal, also I'm being informed. Unfortunately, the non-fatal is so hard to track because they are not considered trauma. As we all know, the hospitals have to submit reports for trauma. And because drowning is not considered, it's so hard. Even that I work for the local hospital, and we have the only pediatric ER, it's still to try to get that non-fatal data is still very hard. It's getting better, but I can imagine if I was not working in the hospital, how hard would be But I will say in the local level, I think the medical examiner will be the best. Also to have that connection with the fire department and EMS, because you will get, more the reported of what happened, because the first responders are going to be telling you what happened. More things that maybe you can even read in some of the public records. But at the state level, I feel that we are just so behind to gather, the detailed data and also all the cases. Like, for example, we had a drowning for a 4-year-old autistic little girl, and that was not showing up in the Department of Children and Families. And I called the district director, and I was told by the sheriff's office and the fire department, and even by the hospital, that they called the abuse line to report it, not for the abuse, but it's just to report the death. And the abuse line was, refused to take the case. But the director of the district of the Department of Children and Families said, you need to continue calling me. And I'm like, but people, meaning the first responders, the hospital, don't have time for that. I think it's definitely a lot of things that we can do in the future to help these. It's just, I feel that we are kind of so behind to be able to understand the real numbers. But I agree with Pam was saying, the U.S. Swimming, the report that they send every month is very accurate. Like, I always look, and it's actually, it's very accurate, at least from the local level, it's very accurate of what they are reporting.
And I know we've had an attendee today, Beverly, put in the information where you can sign up to receive USA Swimming's data that they send out on a monthly basis. Sue Nelson with USA Swimming collects that along with her husband, Mick, and I know they're willing to disseminate it. So Sue's email is in the chat function for today's webinar. Blake, I'd like to turn to you and talk about, your biggest successes with Jay Cmf, but also, have you been able to work in your local community in Nebraska to find out any better data?
Well, the best source of data collection that we've been able to attain is through the county health department. Mm-hmm. And we've been really fortunate that our county health department is also the head for Safe Kids, that chapter. So there's a lot of engagement back and forth and the local wise. So we communicate with them a lot to get that information. We also have a really good relationship with our fire department here in the community. We do a lot of collaborative events with them. So we communicate with them a lot. And, they have to be a little careful on how they share information. One thing that Kathy and I do, it's not fun to do, but we actually have Google alerts that tell us whenever a story hits the news that's related to drowning, and we read them every day, and they're very sad. But that's because of the internet and the capability now. It's amazing how much information you get. It's not going to help you with the near drownings unless it's a big enough story that gets the attention of the news media. The near drownings are really, really tough. The commercial pools, like your Ys and the Parks and Recs, a lot of them are tracking their saves and the statistics because they're looking at the quality and the efforts of their lifeguard teams and how they can educate their lifeguards in different ways, and to see what they're doing with their lifeguards, if they're making a positive effect year over year. That's one of our success stories. Is the Omaha Parks and Rec has 14 pools. They have well over 200 lifeguards. Every year they do a lifeguard appreciation day, and they have a little contest between the pools. And they started using Josh Yoder at the swim breaks. Instead of telling the kids to go get an ice cream cone or something and rest for that 15-minute break, they decided to start educating them about water safety when the kids were on break. And after doing that for 2 years, the number of saves they were required to perform dropped 28% in that second year. And in the third year after that, the next year, it dropped another 17. So they knew by being proactive with the children and not just being a babysitter around a pool, a public pool, and getting the children engaged, that they felt like that was a huge factor in just talking to kids and starting that conversation. And also by doing that, they were getting more participants in swim lessons. In the years past, in some of the lower socioeconomic areas of Omaha, they had a tough time getting kids in swim lessons. And then when they started talking to them about it and being safe in the water and all the different aspects, all of a sudden their attendees started signing up more kids to swim lessons. So that's one of the other really positive things that we've had kind of on a local level is working in partnerships with the Parks and Rec and the Wise.
Awesome. So I wanted, before we talk about some of the biggest challenges that you faced in your communities, I think I've heard from each of you that identifying your resources and who those resources are and how they can help you and what you're doing in your local community is so really important when you get started in this. And I want to dive into that a little bit more, because if we, have people who are watching this webinar live or will watch the recording of it later, who are thinking about getting started in their local community, maybe creating a grassroots effort for water safety education, I think that, key resource piece is so important. So I'd like each of you just to talk briefly about what that was like, put yourself in the mindset of when you first got started with this. I know, Blake, you had mentioned some people didn't want to, wouldn't work with you at the start. Can you expand on that a little bit, and how you, were able to form some of those partnerships that have been meaningful over the years?
Yeah, well, the partnerships take a while, and you have to be patient with it. There are stigmatisms sadly, to drowning. Too many people think that it's always neglectful parents not paying attention to their kids, and there's very few families that have gone through that if they're there, if they're on the scene when the drowning happens, it's always, what a worthless set of parents. And so that stigmatism is one you just have to push through and get past, and let people know that, the drownings happen so quickly, and there's so many different things that you can do to prepare and try to protect our children is a good way to put it. But as far as setting up partnerships, you just have to have the patience and the diligence and working it out. We were really fortunate in developing a relationship with Rotary International. And it goes back to Paula's comment earlier when she said go to conferences. We were lucky enough at the first conference, NDPA conference we went to in 2009, we met retired Rear Admiral Jim Underwood. And when we met Jim, he was an incoming Rotary president for his club in Inglewood, Florida. And he said, I'd like to use Josh Yoder as a Rotary literacy project for my club. And he did that in 2010. And since then, over 300 clubs around the United States and some in Canada, even Sao Paulo, Brazil, have used that program. And it's that interconnection with clubs and especially civic organizations like Sertoma, Rotary, Kiwanis. I would encourage people that are looking for help in their communities that they reach out to people that aren't necessarily just water related, because it doesn't have to be Parks and Rec or YMCA or an athletic club with a swim team. Others will get involved once they hear the statistics, and that comes back to knowing the statistics. If you talk to these civic clubs and different people in those organizations, it's amazing how much they're willing to help. They've helped us build life jacket loaner stations. They've helped scholarship swim classes. They're willing to really jump in there and help out a lot. So I would highly recommend that you look within your community for help, not just in the water world, but also outside of that.
I think, Blake, you make an excellent point when it comes to kind of utilizing statistics. And I can't tell you how many parents, and I'm sure each of you on this panel probably have experienced this, how many parents, even reporters that I talk to and do an interview with, who, I'll tell them that drowning is the leading cause of unintentional injury-related death for children 1 to 4. And they don't know how to respond. They were completely unaware of that, that their child was more likely at risk swimming or risk of drowning than a motor vehicle accident at that age. So I think knowing those statistics and empowering them and educating them are so important. Pam, I'll turn to you. I know you mentioned, your sneak attack on the mayor, but I know you've reached out to and utilized so many of your community resources. Can you expand on that a little bit?
Yes, thank you so much. Definitely, it's relationship building, as Blake said, and it takes time to build those relationships, but it is so important to get your message out. The more volunteers, the more people you have working with you, the greater depth and breadth of your mission will get out to the community. So we did start with that United States Master Swimming model of using swimmers and triathletes as volunteers in our program. That was the low-hanging fruit. It was a good place to start. Our fire department, that was a door that was open to us from the city. The fire department provides volunteers for us. They don't want to be pulling children out of the water. They're happy to be in there in the prevention mode. So they're in the pool with us every single night. They provide us advice on our curriculum that we've developed for the open water, and they also provide PR for us. The city provides the background checks at no cost for us. For our volunteers, they provide our venues and lifeguards, as does the YMCA. And then YMCA also has provided our board meeting space for us. And then to find additional volunteers, any type of school that requires community service hours, the Young Men's Service League, the National Charity League, we turn to all of them. And the winner for us, gosh, I had no idea that the Junior League had an army of well-trained volunteers that have to put in community service hours, and they are wonderful. So those are some of the resources that we use locally, and then use the NDPA membership. We get life jackets from Dana Gage and the LV Project. We get Josh the Otter books from Blake to read. We start out every single session with our 3- and 4-year-olds reading Josh the Otter and handing them a book that they can take away with them. So use the NDPA resources as well.
Thanks, Pam. Alyssa, I'll turn to you next on this. I know in our numerous conversations that you and I have shared, I know you're very well connected in Austin. What was that like to build up those relationships in Austin when you first got started?
It was strategic and it was slow, and patience, which I'm not great at, but that's something that I really realized as we started doing this work, that you had to be patient and had to build relationships and partnerships that work for both sides. And that's something that I start any partnership meeting, whether it's a corporate partner, a volunteer partner, anything, with how can we make and build a partnership that's going to meet our needs and meet your needs. I always say I never want to be the nonprofit that has our hand out because we're doing great work and we don't acknowledge what the other side needs. And I think that over the course of our 11 years of existence that we have built some very strategic partnerships and some very solid and sustainable partnerships that are a source of funds, a source of volunteers, a source of in-kind resources, connections. And one of the things that I love is we work with a lot of corporate partners. So we distribute 75,000 of these water safety cards every year. And this little wristband has to be attached. We use 4,000 volunteers to attach those. And that's corporate partners that may be from big companies, but here's the deal. Every person that's attaching a little wristband is also getting educated. And I have found that this message is for everyone, as I think all of us would agree, that there is no one out there, I don't care who you are, that doesn't need to hear about water safety and drowning prevention. And so we work with YMSL as well, and NCL and student groups and corporate groups and anyone that we can. But building those partnerships can be slow, but if you realize what everyone brings to the table and then figure out how you can help meet their needs. So for example, we work with so many different swim schools and we provide them water safety cards to distribute at their swim lessons, because then they get parent education and they don't have to come up with something to do. We give them a tool that works, or we challenge them to take our water safety quiz. We work with so many pool service companies who are in people's backyards every single day. They can leave a water safety card for their customer to show that they care about water safety, or they can challenge them to take our water safety quiz and they educate their families. So it's figuring out for us what we bring to the table as a resource, locating partners that can help us further that, and then looking at how we work together. And again, it's slow. I mean, our partnership with DFPS has taken 5 or 6 years to build to what it is now. But wow, an example of how we increased our reach through that partnership, they do a parenting tips calendar every year that they distribute 500,000 copies of this physical calendar across the state of Texas to families. And I've written the water safety month, the May content for the last couple of years. I had no idea it was going out to 500,000 people. And so we were able to get our water safety quiz link on that page. And so now we've just expanded our reach through one partnership by 500,000 people. And it's partnerships like that, because it is going to take all of us wrapping our arms around this, finding what we're good at, what we bring to the table, doing that well, and sharing the burden. And I hope that you're going to ask later about the challenges, because I do have an answer to that question that I want to talk about. So hopefully we do get to that, but partnerships are key. I can't say it enough, and patience is something we all have to get on board with.
I am going to ask about that next.
Okay, good.
But, real quick, Alyssa, we had an audience member ask, how could they get a hold of some of those water safety cards that you're using as props?
So collinshope.org, we have order water safety materials on there, and we have English and Spanish. So collinshope.org, there's a drop-down menu.
Somehow
You're muted.
I got muted somehow. I don't know how that happened. Sorry about that. Paula, I'll turn to you to talk about some of your community resources and how you form those partnerships with your coalition.
Yes, the things that we did, and we were very lucky, and I will recommend anyone that wants to start is try to identify those champions. Like Pam was saying, maybe it was the mayor in her town. For us, was a local pediatrician. He was, and he moved unfortunately to North Carolina, and now he's actually helping Melissa Sutton and the American Pediatrics to revise the Water Smart booklet, which is a program with the pediatricians. We implemented it here in Collier County back in 2011. But try to identify those local champions, that they are going to be the voice, that when we had meetings, when we went to the county commissioners, he was the one that was kind of carrying the message. And also include always the sheriff, the chief, the CEOs. That is one of the things that from the beginning we did. We always reach out to them. And one of the things that I will say, and sometimes the list is so big, when you do an event, always in social media, tag everybody, include everybody's logo. Even if they only bring one volunteer, just have their logo or their name, because that is going to show them that you appreciate, and also that they're getting the recognition that they deserve. We started maybe with 20 organizations, and now we have 70 partners, that without all of them, what we have been able to accomplish, we will be impossible. And it's just definitely look for those champions, and always listen, and always include them in the conversation, and meet with them. Like we are getting ready. I was talking with one of the founders of the coalition, Connie Purcell. She's from the sheriff's office. I said to her, we need to sit down and meet with the Sheriff Rambas, because we haven't met with him since 2 years ago. He's very supportive. Everything that we need from the sheriff's office, he always does. But it just always try to do maybe in 6 months or a year. Always we meet with them, and also do the proclamations. The proclamations in May, it will put you in the front to the county commissioners or the city council. But I feel that the recognition of your partner, identify those champions, and then we will talk about the challenges. That definitely I think we will spend a lot of time talking about what are these challenges to continue fighting to remove this epidemic.
Awesome. Thanks, Paula. So I'm going to ask each of you now to give me one answer, and you can expand on that one answer. But what was your biggest hurdle or challenge you had to overcome in starting your coalition or your task force or your local efforts? Pam, I'll start with you on this one. And I know Alyssa's chomping at the bit to answer this one, so I can always go to Alyssa. But I'll start with you, Pam. What was your biggest challenge or hurdle with Fort Worth Drowning Prevention Coalition?
It's the same issue that's been echoed multiple times already, and that's keeping all partners in a coalition happy. And you want to try to create win-wins in every situation. And whenever you begin to feel or see the effects of a personal agenda being placed on the table, it's just so important as the leader of the coalition to keep bringing that back to the mission. And so I think that's, you know, when you're running a coalition and you're developing all these partners, and that's what it's all about, is partnerships. You also have to, as Paula just said, you have to make sure that everybody's feeling recognized, that they have a stake in it, everybody's working together well, and that it's a win-win for everybody, and most importantly for the mission and the community.
Thanks, Pam. Alyssa, I'll turn to you. What is your biggest, or was your biggest hurdle or challenge with Collins Hope?
Well, so we've had over the years had lots of challenges in just developing an organization, but I will say, I think right now is the biggest challenge that I think we have, and I bet everyone might agree, is finding the message that will reach everyone, finding the thing that people will pay attention to. And Adam, you know this because we've talked about it, but I know that there's so much, and Blake mentioned it, so much sort of guilt and shame around drowning and around preventable things. And I think people tune out that they need to pay attention because they don't want to pay attention. And so for us, trying to figure out, when we're watching the data and we're seeing what's happening and we're watching the drownings happen, how do we reach people? What can we say that is going to not be shaming, but that's going to be something that they'll pay attention to and realize that drowning has no boundaries and everyone needs to pay attention. We've done so many different billboard messages, ads, social media, whatever it is, but trying to figure out what is that thing that people are going to actually pay attention to and change their behaviors around water, because that's what we're all wanting. We're wanting people to change their behaviors, to be safer around water. We're wanting them to put water safety at the same level as bike safety, car safety, fire safety, all of that stuff. But how do we get people to put that in the front of their brains and pay attention without doing it in a shock and awe kind of a way? I mean, at Collins Hope, you know, Colin used to say, today was the best day ever. That's kind of our mantra as an organization. We want people to love the water. We want them to be safer. So how do you find a message where you're gently putting a very serious thing in front of people and asking them to pay attention and do something about it, take action about it? So that's right now our current biggest challenge, is how do we get people to listen? Because in our own community, and I'll just use this as an example, in the last month, we've lost at least 6 children. And 2 of those were in very high income family backyard pools. One was in a very high income hotel pool. These are places where, you know, we really feel like we're trying to figure out how do we get the attention of everyone. It is not a socioeconomic thing, and I think people hear some of the data, not the data, but some of the messages that are out there that put this sometimes as an issue that affects lower socioeconomic families more than it does. And for us in our area, it's not the case. So how do we get people to pay attention? How do we get them to listen? How do we get them to change their behaviors? How do we get them to realize this is all of our issue? Whether you're a parent, a grandparent, a child, a caregiver, or a teen, or, you know, you love water yourself, you have to pay attention. So right now, that would be the biggest challenge. So, you know, how do we reach everyone with messages? Because if we can get them to change their behaviors, we can get people to even think about it, then we can, I really feel like, make a change and change the culture.
You know, Alyssa, I know you and I have had many phone conversations where the words drowning doesn't discriminate.
Yes.
Have been given back and forth. Paula, I'll turn to you. What is your hospital or your coalition's biggest challenge been working with the community on water safety?
Yeah, there are a couple things. I will start. One is like what Alyssa is saying, is what we're doing is working. Is the message that we're using is working. And right now we are actually in the middle of a research project. Our coalition was selected by the National Leadership in Public Health, and we're going to be doing focus groups with different groups in the community. And we did one last week, and we were talking about how many of them, they were moms, how many of them had seen our Facebook outreach, and none of them have seen anything. And we're like, oh my goodness, what do you mean you haven't seen? Because we do the planning and target the ads and everything. But anyway, definitely the one of the challenges is like, what we are doing is working or not, because the numbers of drowning is still very steady. They are not dropped the way that we wanted it. Definitely the population has increased, but we just need to make sure, and only through research is going to let us know if it's working or not. The other challenge is the funding, the sustainability. We have done government grants, foundation grants, and what is the best thing we have done? Golf tournaments. One of the things that when we started the coalition was, we are not going to ask the agencies to do things for free. We have to provide funding. And that's one of the things, like the City of Naples, Parks and Recreation, and the YMCA said, that is so nice that the coalition reimburses them for Swim Central. You know, that we are not always asking for free stuff for them to do free swimming. We provide the funding. And I think that is the reason why, you know, the partnership is becoming stronger. But what is the best way for us to be sustainable? Is grants, private donations, events. And I will say to you, after 10 years, I will say the family foundations, the big donors, and also to identify an event that can, you know, can be successful and fun. We just did a duck race, the rubber duck race, and that will be maybe I will do a presentation at the NDPA conference about that. We have a Stewie the duck. Everybody knows about the Stewie. And we are selling these ducks, which Chicago does this event. They do 60,000 rubber ducks. We did 10,000 rubber ducks in the water park, and we did a water safety festival on that day. And it was a completely success. Everybody loved it. And it was $10 to adopt the duck. And that is going to be something that we were going to continue. And lastly, about the funding is also being the peacemaker. It's just, I feel that everybody comes, not everybody, some people come with different agendas. And you, as the executive director or coordinator, have to kind of piece and make sure that everybody's being listened, but also that, and I think that is the beauty to having a strategic planning, to make sure that you can follow that strategic planning. And that way, if somebody new comes or somebody comes with an idea, you say, no, the data, the trends are these. We need to continue following the strategic plan.
Blake, I'll turn to you. How have you, or what is your biggest hurdle or challenge been with JCMF when you got started?
Well, the biggest challenge when you if you start a nonprofit or you go out looking for funding, is most people think there's a pie there and there's only so much that you can get from it. And so a lot of times when you reach out, there's people concerned that if you get attention, they're not going to get as much funding. And that's when, especially when you're new and people say, well, we already give to the Heart Association or the Red Cross or whoever the case may be. It takes a while to build past that point. But, you know, one thing that I have realized over 11 years of doing this is drowning is something that you can't say that you prevented somebody to do necessarily. So if you educate a child to not go around water unless they get an adult, you have solved a major problem if they would have done that. But how do you know they would have done that? And so preventing something is a lot harder to track and have a statistic on than, let's say, curing something. So what we've understood over all the time is it's going to take many, many years. That's why part of what we say is it's a generational change, to where we can start seeing behavior being impacted differently. And we've been doing this long enough now that that challenge was in the beginning of saying, are you really making an impact? And so when you go out and ask for support and dollars, they say, okay, you give a child a book. How do we know that that's going to make a difference? And our biggest statement is, hey, we have to create awareness to this problem. If we don't create awareness to the problem and we ignore it, then we're never going to get anywhere. And so I would say that was the biggest one. The other one for me personally is children keep drowning. And I've been at this 11 years. And sometimes the hardest thing is to wake up the next day and say, is this all fruitless, or are we making a difference? And personally, that's the hardest thing. And you have to just know deep down in your heart that you are making a difference and that you're saving lives. And anybody that's out there that's talking to anybody, trust me, you're making a difference, and you need to just know that deep down inside, because it's really hard to just be able to put your finger that you're of all the great work that you're doing.
Absolutely. I know this is going to take us a little over time, and I usually have a hard and fast rule of ending these on time, but I personally really want to get to this last question because I think this is something that people can really walk away with. If you were talking to someone who is just getting ready to start a grassroots initiative in their local community or their city or their state, what is one thing that either you would have done differently, or if you would have wished that you knew what you know now, if you wish you knew that back then? If you could think of just one thing that you would either change, or you wish you could go back 10 or 12 years and tell yourself. Paula, I'll start with you.
I don't know. I don't know. Meaning, it's a hard question. I think we did it good. We were very lucky because we started. We were lucky because one, we had partners right away that wanted to be involved, and also we had Broward next to us. I will say, just anyone who wants to start, one, get the data through the medical examiner or the local health department. Try to get the first responders, the hospitals, the aquatic facilities. And also don't replicate the wheel. I will be more than happy to share my strategic plan. And I will be happy to, and we have done that here in Florida, that we have drove like Portchard County, some of us in Sarasota County to share how we did it, the small steps. And maybe one of the things was, we wanted to be big. We wanted to teach 2,000 kids the first year. And then definitely it took us only a couple of weeks to realize, no, that is not going to be doable. But we started small and then it started growing. I would say definitely start small, get the partners, get the first responders in the hospital. They are the first ones that have to leave, when they respond to these tragedies, and they will be more than happy, I know, because they don't want to respond anymore to this. And that doesn't discriminate. It doesn't discriminate. It's the beautiful multimillionaire homes to the low-income homes. But I will say, don't recreate the wheel. There's a lot of agencies around the nation through NDPA that I know we all are happy to share our strategic plan and what we have done to start. And yeah. But I will say just that start small, get those partners, and get the data, because you don't want to be doing something that is not going to pertinent to your community.
Absolutely. Paul, I know we've had someone request in the question and answers how they can get in touch with you for that strategic plan. So if you could discuss that with them. Paula's information is also available on ndpa.org under our Board of Directors section. Pam, I'll turn to you, and what is one thing you wish you could share with someone who is just getting started?
I would, I'd have them, and I hear the sirens going off in the background, so sorry about that. Wednesday at 1 o'clock, first Wednesday. Leadership, your leadership style, and reaching out to have people surround you who do not have the same set of skills nor look like you. So I think it's just really important to bring diversity around you, both in skill sets, industry, and racial and ethnic, gender diversity. Bring people around, listen to them. I have learned so much through this process. It is just, I love the people I work with. I learn from them every day. One of the difficult things for us in Fort Worth are cultural issues. I reach out wherever I can. If I'm serving dinner at the Union Gospel Mission, and one of the guys that serves with me is a priest on the north side of town in the Hispanic community, I bounce ideas and thoughts off of him. Just reach out and bring that cultural diversity around the table, especially at the leadership level, to help you understand your community and how you can best effectively get that messaging across.
Thanks, Pam. Blake, I will turn to you. What is one thing you wish you could share with someone who's just getting started?
Reach out and find whoever you can to collaborate with. Don't take the thing on by yourself. There's so many different opportunities for partnerships. One of the first things that I did was I got online and I found the National Drowning Prevention Alliance, and just the name within itself, the Alliance, all the wonderful people that I've met that are part of that organization, helped us tremendously. So don't feel like you're on an island and you can only do it by yourself. Reach out, find partners within the water safety and the swimming world, but also find them outside of that. And just be willing to work with everybody. You know, there's once you start working with people, they want to work with you, and that's how we build momentum with this. And that's why I so strongly believe in the National Drowning Prevention Alliance, that the only way we're going to do something about this problem is doing it as a collective, as a society. And so as a society, that means we get everybody involved as much as we possibly can. So I would say get out there, talk to people, and engage with them, help them with the things that they are trying to do, and they'll help you. So sometimes you end up going and helping maybe with a tree planting project for a local Rotary, but that's okay, because they need help with it, and they'll turn around and help you. So if you give, they'll give back.
I think that goes along the same lines of don't recreate the wheel. If someone's doing it really well, replicate what they're doing, don't reinvent it. Alyssa, last but not least, vacation girl and birthday girl. What do you wish you could share with someone who's just getting started?
Well, I wrote down some notes as everyone was speaking, so I'm going to reiterate what they said, because what they said, and then I'll add on to it. So like the data, know your data and use it locally so that you're working on the right problem. Do not recreate the wheel. There are so many of us out there that have been doing things and want to share and want to not make people reinvent the wheel. Find your hedgehog, which is a concept from the Good to Great book, but what you do well, what you have passion and resources around, and do that 85% of the time, and then lean on other people to do what they do really well, which is partnerships, and then evaluate what you're doing. I can't talk more about this. I know what Blake talked about. It's really hard for us to measure in prevention all the drownings that we prevent, but we can do some evaluating around the programs that we're doing and the strategies that we're using, and see if they're working in certain ways. Are we reaching people? If we're not, then we need to change what we're doing, change it up, and try something different. Don't be afraid to fail. I know we have tried things over the years, and some of them have been epically amazing and some have been not so great, but don't be afraid to take a few risks in this work, because it's going to take that to really figure out what's going to help people change their behavior. And then ask people and talk about this issue. I talk, because the more people we get talking about water safety and drowning prevention, the more we're going to get people changing their behaviors. And I think that's the key. So I think everyone gave fantastic answers. I think right there alone, this last 5 minutes can help people so much if you're starting out. And just know that there's such a network out here that we all want to do this. We all do not want to, we want not one more drowning. And so we can work together, and we're out here. I can't tell you how many times we share what we're doing or lean on somebody else for what they're doing well. So let's keep on doing that.
Thanks, Alyssa. And I think that's going to draw us to a close. We went 7 minutes over, which is a first for me. But I think this was such a great discussion. I know some people have asked where they can get resources. Feel free to reach out to any of us. Alyssa shared her contact information in the chat today. Everyone else's contact information can be found on ndpa.org, including mine. Feel free to reach out. We are here to help you as a resource, and NDPA again will be, this webinar is kind of our first step in our grassroots initiative focus for the next year. So you'll see more and more resources and more webinars around these topics over the next year. I'd like to thank each of you, Alyssa, Blake, Pam, and Paula, for taking your time out to share your expertise with our audience. And I know it's a holiday week, so thank you for sticking around, and Alyssa, taking time out of your birthday and your vacation to join us. I'd like to thank each of you at home for joining us, and also D&D Technologies for sponsoring today's webinar. The NDPA's next webinar will be on Wednesday, July 17th. A little bit of a change on that day. The webinar is going to be live at 2 p.m. instead of 1 p.m. to accommodate some of our speakers. We have Joe Ohem, Alan Korn, and New Jersey State Representative Sean Keene, who will be joining us to talk about state and federal legislation efforts in water safety and drowning prevention. Remember, these webinars are free to join and they're also free to view post recording at ndpa.org. We usually have those live up on the website within 48 hours after the webinar. And just a reminder, the National Water Safety Conference is April 5th to the 9th in Fort Worth, Texas. You can find more information and submit a presentation or a poster session at watersafetyconference.org. I'd like to thank everyone again and wish everyone a safe and happy Independence Day. We will see you on July 17th. Thanks, everyone.
Bye.
Thank you.